Afternoon, everyone, and thanks for this opportunity to speak about protecting workers from growing food insecurity exacerbated by U.S. tariffs. My name is Bridget King, and I'm with the Vaccine Health Promotion and Vaccine Preventable Diseases Division, and our director is Lucy Bilbo. So we'll begin with the definition. Household food insecurity is the inadequate or insecure access to food due to business. It matters because from infancy to adulthood, people experiencing food insecurity will have poorer mental and physical health. In addition, children experiencing food insecurity will have a variety of developmental risks. And adults experiencing food insecurity will experience multiple chronic conditions such as heart disease, diabetes, and mood and anxiety disorders. In addition, they experience higher mortality rates with increasing mortality, with increasing severity of food insecurity. We measure household food insecurity through the Household Food Insecurity Survey module. This is a validated tool that's been used in Canada since 2004, and most recently has added to the Canadian Income Survey in 2019. Food insecurity ranges in severity from worrying about running out of food before the household members have more money to buy more, to modifying the amount of food eaten, to experiencing hunger, and in its most extreme, going a day or more without eating. Despite common assumptions, employment is not a guaranteed safeguard against food insecurity. In fact, over half, 60.2% of food insecure households rely on wages and salaries. Among the most at risk for food insecurity are female-led one-parent households receiving any form of social assistance, individuals most impacted by systemic racism, and historical and ongoing impacts of colonization. This includes Black and Indigenous households. The incidence of food insecurity in our service area is increasing. From 2022 to 2024, almost 1 in 5 households experience some level of food insecurity. This is up from 2019 to 2021, where it was at 16.3%. Since 1998, boards of health have been mandated with monitoring food affordability. This process helps to assess whether households can afford a basic nutritious diet or the Ontario Nutritious Food Basket meal and equity. To make this data meaningful at the local level, Ontario dietitians and public health develop detailed income scenarios each year. These scenarios reflect different household types and different income sources. For 2025, ODPH developed 13 income scenarios, 2 of which I will highlight in this presentation, but all of which are available on your board package. This scenario highlights a family of 4 on Ontario. And for the first time ever, we find that this household is already in debt by over $100 after just considering for the cost of rent and the cost of the UNFB, the Ontario Nutritious Food Basket. This is before any other essential household items are considered. Earlier this year, Public Health Ontario and Ontario Dietitians and Public Health released the first ever provincial report on food security and food affordability. To contextualize food costs and incomes, the report used market basket measure estimates for other basic needs like transportation, clothing, hygiene items, internet, and the internet. The total for this was over $1,700 per month. A family on Ontario Works is not just struggling to eat, they're unable to meet even the most basic of human necessities. I'd like to introduce you to Sam. Sam is a 26-year-old living outside of the city of Intersect. Not long ago, he had a stable, well-paying job at a local pulp and paper mill. But when the mill abruptly shut down, Sam was laid off, without warning and without access to employment insurance. After weeks of unsuccessful job hunting, Sam turned to Ontario Works for support. What he found was devastating. The Ontario Works shelter allowance is just $390. This is far from his cost of rent. As you can see from this slide, Sam is already in debt by over $400 when just considering the cost of rent and the cost of food. Sam is terrified of losing his housing. Sam's job search is limited by geography. Rising vehicle costs, maintenance costs mean he can't afford to travel farther for work. This month, he couldn't pay his cell phone bill. This cuts off a vital lifeline for job applications, interviews, and staying connected. Sam is skipping meals and is considered food insecure. Sam recently found employment, temporary part-time employment, but the system punishes him for trying to get ahead. Ontario Works claws back 50 cents for every dollar earned above a $200 monthly exemption. This means that his hard-earned income barely makes a difference. Instead of lifting people out of poverty, the system traps them in. Sam's story is heartbreaking, but unfortunately, it is far from unique. Across Canada, 7 in 10 households that rely on social assistance as their primary source of income are food insecure. Household food insecurity is directly linked with increased healthcare costs. When people can't afford to eat, they get sick more often, stay sick longer, and require more intensive care. This takes a major toll on our healthcare system, but it doesn't have to be this way. Addressing food insecurity before it happens, ensuring adequate income support and access to basic needs can lead to significant savings for our public healthcare spending. More importantly, it leads to building stronger, more equitable communities where no one is left behind. Compounding Sam's worries are the current trade uncertainties with the US. The Canadian food system is complicated and heavily integrated with the US food system. Many Canadian grown products are processed in the US. This integration will lead to disruptions in food availability for consumers. Tariffs are projected to increase the cost of staples significantly. This will disproportionately affect households and limited incomes, leading to more food insecurity. Although not a solution to food insecurity, food banks are already experiencing increased demands on their, and they're already struggling, to meet increased demands. Trade uncertainty contributes to broader economic uncertainty for all industries. This typically leads to job losses, again, resulting in more food insecurity. These tariff uncertainties underscore the urgency of acting now to address inadequate incomes that are leading to food insecurity. As noted, the local data shows increasing rates of food insecurity, and they are monitoring for affordability data demonstrates insufficient social assistance rates. To help individuals like Sam to rebuild their lives, we must ensure income solutions and adequate supports are in place to reduce household food insecurity. Policy decisions play an important role in determining food insecurity rates because many of these decisions directly impact a household's financial circumstance. Income solutions address the root problem of food insecurity. They help to preserve dignity, give choices to buy foods that meet needs and preferences, and they promote the right to food. As noted in your briefing note or your briefing note, all levels of government have a role to play. Municipal governments can get involved with local food insecurity work groups and support income filing tax credits. Provincially, government can address the inadequacies of the social assistance program, in particular, increasing the earning exemption to better support those trying to leave the OW program. And finally, the federal government can consider and explore a basic income guarantee. These strategies will go a long way to support Sam and others like them. Ultimately, strategies that decrease food insecurity will lead to cost savings for the healthcare system and support healthy, equitable communities. Thank you, merci, and much.
Thank you for the presentation. We'll open it up to questions. Any board members have any questions or comments, whether online or in person?
I have a comment.
Go ahead.
Shmee again for your presentation. Like the others, it was very thorough and informative. One of the things I would like public health to consider, and this is paramount when it comes to the Citizens Plus and what our food security and food sovereignty looks like. And that's all around our harvesting. I'll take my board hat off and speak a little bit about what Chicago Health Center has been doing for time immemorial, but in the last, I'll go back to, I've been there for 16 years, so 14 years, we started our wild food bank. This is something that I believe public health needs to ensure that they partner and support food banks such as ours, that where our individuals cannot go back into our traditional territories to harvest like we once did. We have a team that partners with our youth hunt camps or harvest camps and our community harvest camps, where we have registered butchers, that everything is, in line with public health. But public health also needs to make sure that this is a priority when you're talking about food sovereignty from Citizens Plus in our territory, that it be recognized and that we work together, even with conservation officers, which we have, we've built a reciprocal, respectful relationship, but that's not always the case when it comes to Citizens Plus in this territory, and as you could understand why. So I want to ensure that when we're talking about food sovereignty, that we go back to the original harvesting territories that our people have been harvesting for time immemorial. So to me, what you thought?
Thanks, Andrew. That's duly noted. Is there any other?
I have a question related to the motion that's associated with this. Can I ask that now, or is it?
Yeah, please go ahead.
So my question is more of a general one. I mean, I have no issue with the motion itself, but when we do it often, when we make motions where we call upon either the provincial government or the federal government to do something, what kind of response do we get?
Yeah, Mr. Chair, I find with the federal government, usually we'll get some sort of letter back from them, acknowledging what we said, usually making a claim that, yes, we're already doing this, we've done all these other things, but they list some sort of response. I find with the provincial government, they tend not to send us any response. It sort of gets sent to them and it goes in the black box that is a provincial government, and we never hear back, unfortunately. I do point out that, nicotine pouches was a motion that this board passed last year, and several other boards passed the motion around the same time, and shortly after that, we actually saw a change in federal policy. So sometimes I think this advocacy does have an impact, but sometimes it's a bit of a black box of what the impact is.
Just, Mr. Chair, follow up, is there any approach to dealing with that? To, trying to solicit a more formal response? I mean, we go to a lot of trouble to table these issues, and out of respect, I think it would be appropriate for them to at least respond, even if it's a response indicating that they can't do anything at this time.
Yeah, so Mr. Chair, I think, something maybe we could do, which we haven't done in the past, maybe do a follow-up a couple of months later to check in on how things have gone. Something we've been trying to do much more is that we don't just send the advocacy, but we send the advocacy and say, we are willing to come and help you. We're happy to set up a meeting, offer our support, and say that invitation also leads to anything.
Thank you.
Thanks, Bob. I can't see anybody online, so I'm not sure, Michelle, is there anyone who has their hand online? Just want to comment, Bridget, that also I just highlighted the fact that it's not just the food and being able to support and it affects their health. It's also about the stress on an individual or their families as well. Because if they can't provide for themselves or their families, it's not a burden to their mental health. So, and the last thing I wanted to bring up, and I know I saw it on the graph, but how often do we update or get updates on the food insecurity and where our levels are at? Is that on every 2 years?
So, we actually get it yearly. So because it's been added to the Canadian Income Survey, we do have the yearly food security data. So the 2024 year is doesn't know.
Do we know if that's gone down or is that still rising? Okay. Thank you for that. Again, is there any other questions for directors? Richard? None, thank you.